So continuing with our question 22 of previous year NEET PG questions, 2024 question. So which of the following is the most consistent with these symptoms? So the symptoms are: a 62 years old female presents with left-sided arm and leg weakness, right-sided complete facial paralysis, and difficulty with horizontal eye movement. So let's put these in technical terms. Left-sided arm and leg weakness is left hemiparesis or hemiplegia. There is a right-sided complete facial paralysis. The word complete is very important here because in facial paralysis we have two types: upper motor neuron type of facial paralysis and lower motor neuron type of facial paralysis. You would have known in the nerve supply of face there is bilateral innervation of upper motor neuron fibers. Okay, the particular sided upper motor neuron fibers supply both the upper halves of the face and the lower half of the face. So there is contralateral innervation. So in upper motor neuron palsy, we'll draw the other side also. So this side also innervates both the upper halves and single half, lower half. So when one-sided upper motor neuron fibers are affected, definitely the lower half of the face will be affected, but the upper half is spared because of the contralateral innervation from the other side. Okay, this is some fact which we must remember. So in upper motor neuron paralysis, there will be only lower half of the face will be palsied, whereas if it is a lower motor neuron type of palsy, the entire half of the face will be affected. So that is the word here. So they have given right-sided complete facial paralysis. So this is a lower motor neuron type of facial paralysis of the right side. So what do we have? We have left hemiparesis and an opposite-sided facial LMN paralysis. So that's a crossing of sides, right? Left and right. And difficulty with horizontal eye movements. Most of us will not be able to pick up this clue, and I think it's not relevant because the other two clues are enough. This is actually a case of crossed hemiplegia. So when do you say a person has crossed hemiplegia? When there is hemiparesis of one side plus actually it is hemiparesis of contralateral side and ipsilateral facial or cranial nerve palsy. I'll just explain it in brief. You know very well that there will be crossing of fibers, crossing of the corticospinal tract fibers at the level of the medulla. So assume that there is a lesion somewhere in the brain. Assume that it is in the pons. Okay, that is the corticospinal tract has not yet crossed. So there is a lesion in the right-sided level of pons. So what will happen to the corticospinal tract of the right side will be affected. That will cross to the left side in the medulla and it will innervate the left half of the body, left arm and left leg. So when there is a lesion of the right pons, there will be left hemiplegia or left hemiparesis because of the crossing occurs at the level of the medulla. At the same time, cranial nerves have an ipsilateral supply. So when the right pons is affected, pons has the lower motor neuron fibers of the facial nerve or the seventh nerve. So there will be LMN type of facial palsy of the right side. So you can see how there is a crossing. There is a left-sided hemiplegia because right-sided pons is affected and the right-sided corticospinal tract is affected. There is a left-sided cranial nerve palsy. In this case, it is a facial nerve palsy. So it will affect in the same side. So that is why the term ipsilateral and that is why the term contralateral. So an ipsilateral cranial nerve palsy and a contralateral hemiparesis, this combination together is called as crossed hemiplegia. This crossed hemiplegia will occur only when part of the brainstem is affected. Please remember. So what are the parts of the brainstem? As you know, there are midbrain, pons, and medulla. These are the parts of the brainstem. And you also know very well that two cranial nerves originate from the midbrain. They are the third nerve and the fourth nerve. Third nerve is the oculomotor nerve. Fourth nerve is the trochlear nerve. So these two help in eye movements. So the same situation occurs here. If there is a lesion in the midbrain in one side, for example right side, the right side third nerve and fourth nerve will be affected, but there will be a left-sided hemiplegia, right? What are the cranial nerves which arise from the pons? They are 5, 6, 7. Fifth nerve is the trigeminal nerve. Sixth nerve is the abducens nerve. Seventh nerve is our famous facial nerve. Okay. We can say the eighth nerve also. Eighth nerve is the vestibulocochlear nerve. But people say it originates from the pontomedullary junction. So anyway, it is taken as pons only. Now what are the cranial nerves which originate from the medulla? The lower four cranial nerves. 9, 10, 11 and 12. Ninth nerve is the glossopharyngeal nerve. 10th nerve is the vagus nerve. 11th nerve is the spinal accessory nerve. And 12th nerve is the hypoglossal nerve. So we discussed third nerve and fourth nerve has to do with the eye movements. Fifth nerve supplies the face. They control the muscles of mastication and as well as they carry sensations from the face. Sixth nerve is again for eye movements, abducens nerve. Seventh nerve or facial nerve helps with muscles of facial expression. Remember, trigeminal nerve is for muscles of mastication and facial nerve is for muscles of facial expression. Also, they carry sensations from the tongue, anterior 2/3 of tongue. Vestibulocochlear nerve is for hearing as well as balance. Glossopharyngeal nerve carries sensations from the posterior 1/3 of tongue as well as they help in palatal movement. Vagus nerve supplies the larynx and pharynx. Spinal accessory nerve supplies two muscles, trapezius and sternocleidomastoid. Hypoglossal nerve controls the motor movement of the tongue. So this is just a basic revision. Knowledge of this is important because in crossed hemiplegia we have some named syndromes. For example, there are many syndromes. We'll just tell few important things. There's something called Weber syndrome. Weber syndrome is very easy. Weber syndrome is a midbrain syndrome. I told you there will be hemiplegia, right? So there will be, if one-sided midbrain is involved, there will be contralateral hemiplegia. And what cranial nerve comes in the midbrain? It's the third nerve. So there will be problems with eye movements. So contralateral hemiplegia plus ipsilateral third nerve palsy. Right? If you read the cross section of midbrain, there are some important structures such as red nucleus, third nerve nucleus and fourth nerve nucleus. Based on that, we have few other syndromes, like something called as Claude syndrome. Like if red nucleus is involved, there will be the same thing. There will be contralateral, there will be ipsilateral third nerve palsy. That is the same. Plus, instead of the corticospinal tract, if red nucleus is involved, we will be having contralateral ataxia. Right? So, Weber syndrome is ipsilateral third nerve palsy and contralateral hemiplegia. Claude syndrome is ipsilateral third nerve palsy and contralateral ataxia. We have Benedict syndrome. Benedict syndrome is combination of Weber plus Claude. So there will be ipsilateral third nerve palsy as expected, plus there will be contralateral hemiplegia, plus contralateral ataxia. So ipsilateral third nerve palsy because third nerve nucleus is affected. Why contralateral hemiplegia? Because corticospinal tract is affected. Why contralateral ataxia? Because red nucleus is affected. So the midbrain syndromes are Weber syndrome, Claude syndrome, Benedict syndrome. We have few other syndromes. We are not discussing everything to avoid confusion. In PONS, think of Millard-Gubler syndrome. So Millard-Gubler syndrome is again ipsilateral seventh nerve palsy. Okay, ipsilateral seventh nerve palsy and contralateral hemiplegia. Ipsilateral seventh nerve palsy. So there will be element type of facial palsy in one side plus contralateral hemiplegia. Again, we have many other syndromes, like there is a syndrome called as Fovili syndrome. It is also Fontaine syndrome. Fovili syndrome is a same hemiplegia, contralateral hemiplegia with sixth nerve palsy. Okay. Actually, Millard-Gubler syndrome will involve both the sixth nerve palsy as well as the seventh nerve palsy. That's why in Millard-Gubler syndrome will be having a facial palsy as well as a gaze palsy plus contralateral hemiplegia. Whereas Fovili syndrome will have only sixth nerve palsy. That is, there will be contralateral hemiplegia plus ipsilateral abducens nerve palsy. So there will be gaze palsy. So that is Fovili syndrome. Coming to medullary syndromes, we have one famous syndrome, the lateral medullary syndrome. Lateral medullary syndrome is also called as Wallenberg syndrome. We have another syndrome called medial medullary syndrome, also called as Digerin syndrome. Remember, in cross section of brainstem, sensory is lateral, motor is medial. Sensory is lateral, motor is medial. So when thinking of lateral medullary syndrome, there will not be hemiplegia, but there will be contralateral hemianesthesia or contralateral hemisensory loss. Plus there will be ipsilateral features of, there will be contralateral hemianesthesia. Plus we have few other structures which are lateral, like the entire trigeminal tract is lateral. Okay, the hearing apparatus is lateral. So we'll be having cerebellar symptoms because the cerebellar fibers will be lateral. So there will be ataxia here. Okay. Ataxia and ipsilateral facial sensory loss. So just remember three things. There will be contralateral hemianesthesia plus ipsilateral ataxia and facial hemisensory loss. So why contralateral hemianesthesia? Because okay. Coming to medial medullary syndrome, what all is medial? Entire motor is medial. Tongue is medial because tongue hypoglossal nerve is also a motor nerve. So there will be tongue palsy, which is ipsilateral, or hypoglossal nerve palsy, which is ipsilateral, and contralateral hemiplegia. So if you are getting confused, we'll just summarize it shortly. There is a term called as crossed hemiplegia, where there is a lesion of a particular side of the brainstem, whether it is a midbrain or pons or medulla. So in crossed hemiplegia, there will be ipsilateral cranial nerve palsy and a contralateral hemiplegia. For example, in Weber syndrome, there will be ipsilateral third nerve palsy and a contralateral hemiplegia. In Millard-Gubler syndrome, there will be ipsilateral sixth nerve and seventh nerve palsy and contralateral hemiplegia. Fovili syndrome, there will be ipsilateral sixth nerve palsy and contralateral hemiplegia. Lateral medullary syndrome, there is ipsilateral ataxia, facial hemisensory loss, and contralateral hemianesthesia. Right? So these are some of the syndromes. Now I think this question will make sense. Patient is having a left-sided arm and leg weakness, right-sided facial palsy. So there is right-sided 7th nerve palsy, and they are given difficulty in horizontal eye movement. Probably it is a 6th nerve palsy, and there is a left-sided, that is a contralateral hemiparesis. So this is clearly a crossed hemiplegia with 6th nerve and 7th nerve involvement. The answer is Millard-Gubler syndrome. Had they given only a problem with horizontal eye movement, the answer would have been Foveli syndrome. Okay, 7th nerve plus 6th nerve is Millard-Gubler, only 6th nerve is Foveli syndrome. Benedict syndrome is a crossed hemiplegia syndrome of the midbrain. As discussed, involvement of red nucleus and involvement of corticospinal tract. So here there will be contralateral hemiplegia, contralateral ataxia, and ipsilateral 3rd nerve palsy or oculomotor nerve palsy. Wallenberg syndrome is lateral medullary syndrome, where there will not be hemiplegia, there will be contralateral hemianesthesia and ipsilateral facial hemisensory loss and ataxia. Okay.